Thank you for choosing Floyd Medical Center for your orthopedic surgery. As part of our goal to deliver care that goes well beyond expectations, we've created this video as a companion to the extensive patient guide you've already received. We understand that with any medical procedure, there's a certain level of anxiety, which is why we strive to provide as much information as possible prior to your surgery. You can take comfort in knowing that Floyd is a quality and customer service leader with unmatched medical expertise, and we are among the top Georgia hospitals in the prevention of surgical infection. Your surgery will take place in a modern surgical suite equipped with operating room of the future technology, including high-definition imaging. These medical advances allow physicians to perform surgery that is minimally invasive with maximum benefit. After surgery, you will be cared for in deluxe rooms designed with your comfort in mind. At Floyd, you and your surgeon will have the advantage of working with a highly trained team of healthcare professionals whose primary objective is to provide you and your family with the highest quality care. Let's meet that team. The Joint Care Coordinator manages the patient care process from pre-op through discharge and any required post-op procedure. This includes daily assessments of your progress, regular communication with your physician, and any other need you may have during the surgical process. You will also have a social worker assigned to you who will coordinate your discharge plans with the nursing staff and physical therapist and identify any specific discharge needs. They will also make arrangements for your continued care after discharge and will assist with insurance and financial questions or concerns. Floyd's physical therapists will coordinate your rehab program, which will include daily group therapy sessions. The physical therapists will also schedule individual exercise sessions as needed. Finally, an occupational therapist will help you develop effective methods of handling day-to-day activities and will demonstrate temporary lifestyle changes for safe care at home after discharge. Together, this group of professionals will ensure that you are comfortable and well taken care of through every step of the procedure. Your comfort throughout the surgical experience is one of our top priorities. That's why we work so hard prior to the day of admission to prepare you for what's to come. Now, there are some subtle differences in the preparation process for surgery at the hospital compared to the outpatient surgery center. That's why we encourage you to read through the information provided in your guide. For now, we'll focus on those steps that are common to both. There is an extensive pre-surgery task list outlined in your patient guide. We encourage you to use this list to be well organized and prepared for surgery. Soon after your surgery date is set, a registered nurse from the Floyd Preoperative Evaluation Center will call you to complete a brief questionnaire and schedule an appointment. You will also be scheduled for a joint class at this time. Your visit to the center will include a detailed exam by a provider who is trained to optimize your health before surgery. Our providers have specialized knowledge of how surgery and anesthesia can affect your body systems and other medical problems you might have. By reviewing your health history, medications, and previous medical records, the staff works with your surgeon to prepare a customized plan of care for the duration of your hospital stay. This process identifies your unique medical needs and, by doing so, can maximize your safety and comfort. It goes without saying that the day of your surgery will be very busy. That's why we recommend setting some time aside prior to the surgery to pack and prepare yourself and your home for your return. Arrangements will need to be made for someone to stay with you once you return home. Transportation to and from the hospital and to appointments will also need to be arranged. Food preparation will be difficult to manage during the early stages of your recovery, so be sure to make arrangements for food at home by either cooking and freezing meals or by asking someone to manage mealtimes for you. Now that we've taken you through the preparation phase, let's look at what actually happens on the day of your surgery. We'll begin with your arrival at Floyd. We offer a shuttle that can pick you up at your car and drop you off at the front door. We also feature a drive-under portico for those patients who are being driven to surgery appointments. This will allow you to be dropped off at the front doors of the main entrance. Parking at the main entrance will allow easy access to patient registration, the main elevators, the cafeteria, vending, and the 330 Physicians Center where the Floyd Outpatient Surgery Center is located. The 330 Physicians Center also features a drive-up lane for patients who are being driven to their appointments by another person for surgery at the Outpatient Surgery Center. Our guests who prefer covered parking may park in the hospital parking deck located across Turner McCall Boulevard from Floyd. Patients parking here will enter the north entrance through an enclosed overhead walkway. The next step, once you're inside, will be to register, even if you've completed the pre-admission process. There is a check-in desk at both locations. Depending on where your surgery will take place, one of these will be your first stop. Your family and friends will no doubt want to keep up with your progress, and with the use of new technology, Floyd has made that process easier than ever before. There are patient locator boards in the waiting areas of both locations so your friends and family can stay informed by using a patient locator number assigned to you at registration. Additionally, a designated family member will be given a pager so they are more easily reached for progress reports. We understand that the anxiety surrounding surgery extends not only to our patients, but to their loved ones also. That's why we have a variety of amenities available to you and your family as our invited guests. Your patient guide provides detailed information about these offerings, which include comfortable visitor waiting areas with easily accessible nurses' stations, a wide range of dining options, vending and snacks, pastoral care, and translation services. After you've arrived and notified the registration desk, a member of the Floyd team will walk with you every step of the way. When it's time for your surgical care team to begin preparing you for surgery, you will be taken to the preoperative holding area. A family member may join you until it's time for you to receive anesthesia. An intravenous line will be inserted, which will be used during surgery to provide necessary medications and to replace fluids. For your peace of mind, anesthesiology professionals will discuss your procedure and determine which type of pain management best fits your needs. After surgery, your nurse will check your vital signs and dressing often and will be available to treat any pain, itching, or nausea you might experience. Once you're awake, your blood pressure is stable, your temperature is within normal limits, and your pain is under control, you will be transferred to your room. Your nurse will meet you and perform a post-surgery assessment. This will include a check of your vital signs, a check of your dressing and drains, and an overall evaluation to determine the status of your recovery. If ordered by your physician, your home medications will be administered. The nurse's assessment will also include questions about your medical history and the type, location, and severity of your pain. Our goal is to make you as comfortable as possible, so remember that you are the expert on your pain and you will be asked to rate that pain on a scale of 0 to 10. Please let us know when you're uncomfortable and be sure to ask for medicine as soon as the pain is present. The more time that passes between the onset of pain and medication, the more difficult the pain becomes to control. Your doctor will visit at some point during the day. The time of the visit will vary according to the doctor's schedule, as some make rounds in the morning while others visit later in the day. Social services staff will also spend some time with you and your family to assist with arranging home health, as well as outpatient physical therapy if necessary. They will also help with getting any equipment you may need at discharge. If you are in your room by 2 p.m. and medically stable, a Floyd physical therapist will evaluate you and assist you with moving from bed to chair. Along with this initial evaluation, you will also participate in group therapy sessions twice a day, once in the morning at 9:30 and then again in the afternoon at 1:30. Each of these sessions will last an hour. If you have an epidural to help control your pain, this will be discontinued the day after your surgery and your physician will order other pain medications. Nerve blocks typically wear off the day after surgery. Other pain medications will be given once this begins to take place. There are additional post-surgery procedures that may be performed. These can be found in your patient guide. Well, we finally reached the point everyone is most looking forward to. Your surgery is over and it's time to go home. We want to make that transition to home or interim care as easy and convenient as possible. Over the next 6 to 8 weeks, you'll continue with the healing process. One of the keys to a successful recovery is balance. Work through these steps slowly and don't push yourself to the point of pain or exhaustion. The Joint Care Coordinator will conduct a discharge class with you, your fellow patients, and your family. The class will include information about medications, diet, follow-up appointments, and home care services. This information will be important for your recovery. The coordinator will be able to answer other questions and can also help make arrangements for special supplies, home health, or other services. Our staff will work to have you ready for release by 11 a.m. on the day of your dismissal. Arrange for your transportation from the hospital to arrive by 10 a.m. At discharge, patients typically return home. If you live alone, it's important to have additional help for at least 2 to 4 weeks. Home care services can be provided that will include physical and occupational therapy if needed. If no home care is needed, you may choose to go to Floyd Physical Therapy and Rehab, our outpatient rehabilitation facility, to begin to work on mobility and joint movement. Your primary goal after your return home is safety. Be sure to follow the activity guidelines designed by your doctor and physical therapist. It's possible that you'll have the need for various pieces of equipment, including a walker, a shower seat, or tub bench that will allow you to sit while bathing, a raised toilet seat, or a hip kit which will assist you with dressing and bathing. It's important to use your walker for each step you take until your doctor releases you from doing so. You may feel that you can walk without the aid of the walker, but the bones require 6 to 8 weeks to heal. One way to help advance your rehabilitation is to walk daily for increasing distances, allowing for rest between activities. Call your physician immediately if you have questions or if you notice pain or swelling around the incision, develop a temperature over 101, or have a sudden onset of shortness of breath. Finally, please make a note of these reminders. Use your walker and other assistive equipment. Follow the activity guidelines discussed with your doctor. Use pain medications as prescribed. Follow your wound care instructions. Watch for signs of infection or swelling and attend your follow-up appointments. Thank you again for choosing Floyd Medical Center for your orthopedic surgery. We wish you the best throughout this process. Please let us know how we can make this experience the best it can be for you and your family.